Joining us now to examine the U.S. healthcare system is Den Bishop, the author of The Voter's Guide to Healthcare and the president of Holmes Murphy, one of the nation's largest employee-owned and controlled insurance brokers, where he leads the employee benefits practice. So, Den, I'm really glad to have you on right now because we're just now hearing the Trump administration proposing this once again big unveiling of its healthcare policy. The Biden campaign has unveiled its policy, but I think the fact that we're talking about this issue is important. So I want to ask you, is the U.S. healthcare system right now efficient and effective?
Sadly, I don't think we could call the U.S. healthcare system either efficient or effective. Efficient would mean that we're saving lives better than other countries, and we're not. And efficient, means that we're less costly, and we're not doing too well in either of those.
So when it comes to the two candidates, then, there is I'm assuming, a market then to make an appeal to the American electorate who may be seeing firsthand exactly what you're talking about, the lack of efficiency, the lack of effectiveness. So I want to start with exactly what the Biden campaign is looking to do. When it comes to expanding Obamacare, that is something that it's very easy to say that way, but I think it's a little bit more complex when you talk about applications. So what are they looking to do in order to build on the U.S. healthcare system?
The major platform item for the Biden administration is the creation of a public plan option or a Medicare-like program that would be government administered, government negotiated, and in a move to the left from where candidate Biden was in the Democratic primaries. He's made a move to the left. That plan now would be made available to every American, even if you have employer-sponsored insurance, anything. So it would be a new government program is what he wants to offer.
Now, on the other side of that conversation, we don't know exactly what the Trump administration is going to unveil just yet. They are teasing ahead to an upcoming health care plan that's been teased for several years now. But when it comes to the Republican Party more broadly, I remember that it wasn't too long ago when they wanted to repeal and replace Obamacare that they had a hard time putting together the replace aspect. So now when we look ahead to what the Republican Party could be unveiling, do we have a general idea of what it is that they'll be looking to do in order to improve on the system?
I think we have a direction on that. Sadly, I think the Republican Party has been more repeal and erase because they haven't had an idea on how to replace. But you can see what the Trump administration has done, which has really been around trying to bring transparency to costs so that consumerism could be activated and choice. And so anything that you would see from the Trump administration, I believe, would focus in on consumer choice and some price transparency to try to make some of maybe the bad actors in terms of prices of healthcare act a little better with some consumer pressure.
And I think when a lot of people think about healthcare, they can simplify it by saying Biden wants to expand a public option and President Trump wants to go more for the privatization of healthcare. I mean, I think that's really boiling it down to the simplest terms. But when we look at the Democratic Party and we look at what happened during the primary debates, it seems as if the future of the progressive movement wants Medicare for all or universal health care to be what the next system is in the United States. So I want to ask you, do you believe that that is the future of the healthcare system and if it's even plausible?
I don't believe, there's a term universal health care. That would mean everybody has health insurance coverage. I think that would be fantastic. The debate, and I think where the debate falls apart on Medicare for all, is some in our country will want a right without a responsibility. And the problem in healthcare now is half of it's purchased by the government and half of it's purchased by individuals. And we haven't looked to how to connect those in a way that could be better for everyone. So we need to start thinking about how to solve the problems, not just throw everybody into a single government system that's not working. Many of your viewers won't understand, but the Congressional Budget Office released a report about, it was early September, so it was less than 2 weeks ago. The Medicare Part A, the hospital trust fund, is scheduled to be insolvent in 2024. That's when the next presidential election is. Yeah. We've got issues with our government programs and funding already. Expanding them further is very dangerous.
And putting that to the side, because it's very clear that Republicans will never necessarily come to agreement, I think, with that proposal, is there something right now where the two sides can come together?
I think they can, as long as they don't have to admit they come together. And I say that with what I believe the most important item that the Trump administration has done is legislation known as ICHRA, the Individual Coverage Health Reimbursement Arrangement. What that allows an employer to do is give their employees money and let them buy the health care of their choice, whatever they want, kind of a 401k for health care. Well, that Trump administration move is identical and an expansion of an Obama administration move.
Interesting.
So I really think that there's more agreement. Unfortunately, you don't get votes with agreement, but I think we can get to more choice, more freedom without necessarily government expansion. And quite frankly, I think most in Washington, D.C., if they were honest, could agree on that.
Well, maybe they'll figure that out in a 2021 or a 2023, sometime in between elections, something of that sort, because this is a big issue for a lot of Americans, and it seems not being talked about right now, but back in 2016, I think it was the third most talked about issue for many voters, and something tells me it's still on the mind going into November as well. But Den Bishop, I really appreciate you coming on the program tonight and breaking down this complex issue. Thank you.